You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a fixed set of teeth in just a few appointments. With us, my first guest. We've had him on the program before. He is LA's dentist, Dr. Baghdasaryan. Dr. Baghdasaryan, welcome to the program.
Hi, Randy. It's nice to be your guest.
Now, we've had you on the program at least 2 or 3 times before.
Yes.
Is that right? And I don't remember your smile being that nice. Is that, those are all your teeth?
Better over time, yes.
And your smile's getting better. Good for you. For people that don't know you, tell us a little bit about your practice. Who's your typical patient, and what are the different procedures that you do? Because you do a lot of things. I went through your website right before you get.
I'm a general dentist, and I practice in Glendale, California. Mm-hmm. We see patients from all over the Los Angeles area, even beyond. Mm-hmm. In my practice, we do all the dental treatments that could be possibly done in a dental office. Okay. We do crowns, veneers, cosmetic dentistry, Invisalign, orthodontic treatments, gum treatments, implants, IV sedation. We have an advanced machine that makes crowns and veneers.
So right there,
you
have a crown machine right there.
Yes.
Then normally it's sent out, right?
Normally it's sent to the lab.
I mean, these are like $100,000 machines, right?
More than 100,000.
All right.
It's about twice as much.
But is it true that somebody could go like today, and if they wait for a little while, the crown is made right there?
Yes.
Is that right?
Today everybody is in a hurry, in a rush, and they want everything to be done right away. No one wants to wait for about 2 weeks until we get the crown done in a lab.
Okay.
So a lot of patients, whoever has a busy schedule, they can schedule an appointment, come to the office, get the crown the same day, and go back to work.
Okay, good. You know, people always ask me for referrals on my website, and we're not a referral site, and people need to know this is a real interview. I'm just asking the questions here. I'm trying not to endorse you, even though I like you already because you've been on my show. And but when people ask me for a referral, I always say, look, go to a dentist, if you're going to go to a dentist, that does a lot of things, that they've got the imaging right there. They've got, you know, a machine that can make crowns right there. Because usually they could pass the savings on to the patient.
Yes.
Is that right? If you send less things out, or is that wrong?
It is so right. It's a tremendous service to provide to patients when all the services are available under one roof. They don't have to go to different doctors for certain services.
Now, sedation. You also offer IV sedation.
Yes.
So who's attracted to this? The people that are afraid of it? I guess everybody's afraid of the dentist.
Well, there are so many advancements in dentistry, but it still has an image issue. The doctors are trying so hard to make patients to no longer be afraid of going to a dentist.
Yeah.
Even now, there's a lot of patients wince in pain when they think about going to a dentist. And a lot of doctors are utilizing IV sedation or conscious sedation in their offices to make the patient's experience more comfortable, so that they feel more relaxed, take away the fear.
So you do IV sedation?
Yes.
So what, less than like 5-10% of all dentists in the US are IV sedation trained? Is that true?
Yes.
Something like that?
Approximately it's accurate. About 10% of the doctors are trained in IV sedation.
Why'd you get involved in it? Because it's extra training, but why'd you do it?
Because of my motivation to provide the best possible service to my patient.
Is it safe?
IV sedation is extremely safe when it's performed under supervision of a specially trained doctor. Okay. Purely statistically speaking, it's safer than a local anesthetic on its own.
So doing nothing, because I guess it controls your blood pressure,
yes,
stuff like that. Plus you could pull them out of it right away, unlike the pill.
In case of IV sedation, it's easy to pull the patient out of it. IV sedation stabilizes the blood pressure and heart rate of a patient who is afraid to go to a dentist. Okay. Normally, patients who are scared, their blood pressure and heart rate is very high.
So the denture wearers that come to see you, by the way, in today's topic we're talking about no more dentures, get a fixed set of teeth, a full arch of teeth with this, I guess, little as 2 dental implants. Are they big? I mean, do you suggest IV sedation for these people?
Patients who are extremely scared of dental treatment, I do suggest IV sedation.
I think you're the one that told me that certain of these denture patients go in, it's all done, and because you did IV sedation, at the end, they say, that's it? Or is it over?
I had a patient.
Can't remember it? Is that right?
I had a patient who came for implant procedure, and we did the surgery under IV sedation, placed the implants, and she went home. Next day, she called me. She said that when am I coming for implants?
Is that true? Is that right?
I said, you were here yesterday. How are you doing? She said, well, but when are we going to place implants? I said, the implants are placed already.
Is that
They are
right? Well,
inside
wasn't
your
she in
jaw.
pain the next day? Didn't she
No.
wonder why?
There's this misconception about the pain in dental implants. Usually we call the patient the next day or the following day after the procedure to find out how they're doing. And they usually don't complain about the pain. A lot of times they say, then, I had a little discomfort the day of the surgery. I took a tablet of Tylenol and discomfort went away the very next day.
You know, I was talking to, anticipating this show, doing some searching, that there's like hundreds of thousands, maybe 1 million people in the LA County with an upper or lower denture,
Yes,
right? Is that right?
so many.
Okay. And you're saying no more dentures, like with 2 implants, snap in, give them a suck. But if it's so good, if dental implants are so good, in your opinion,
Yes.
then why isn't everybody doing it? What's your take?
Because especially elderly patients who have all of their teeth missing and are wearing dentures, they don't usually go to a dentist.
Good point.
They visit the
Okay.
dental office every 5 years or so to do a reline on the denture. And most of the time they don't know about the advancements in dentistry and about their choices.
So they just don't go to the
restore-
dentist anymore.
No,
So nobody's telling them to do it.
no. And
Good point.
even if they have heard about the dental implants, they think that they might be too old to receive dental implants.
Well,
But
what are
there's
the
a-
oldest patients doing this?
I've had 85-year-old lady, we restored 4 of her teeth with implants, and she was so happy she made that choice. I have colleagues, I have my fellow doctors who've had patients older than 85, 90, 95 years
Really?
old.
And they don't fall out at
No,
80
not at
years
all.
old?
They integrate the same way as with a younger patient.
when you say
If-
integrate, what do you mean?
Attached to the bone. Integrate with
You
the
mean
bone.
the bone grabs onto
The
the
bone
dental
grabs
implant?
on an implant and holds it tight.
Interesting.
If the patient can make it to a dental office, they can get an implant.
Is that right? So age is not a
Age
reason
is
to
not
do
a reason.
Okay.
Well, the patient needs to be an adult, over 18 or 20 years old, so that the bone structure is fully matured and formed.
So I interrupted and I apologize, but my question was, if it's so good,
Yeah.
and there's like 1 million people in LA with an upper lower denture, why aren't they all doing it? Okay, so number one, they don't go to the dentist. What's the
They don't
second
go. The
reason?
second one is that, well, second one we talked about that they think they are too old to receive dental
Okay,
implants.
okay.
And there is another misconception that sometimes they think that it's too costly and it's very expensive because they measure they count how many teeth they need to restore and think that each and every tooth needs to receive an implant. With 2 implants only, it's possible to make the denture fixed and snap in, snap out type of
So
denture.
just a
that is
snap in.
snap in, snap out. It's more stable and doesn't fly out of your mouth every time you cough or smile or
Since
sneeze.
last time you were on my show,
Mm-hmm.
you've probably done a lot of these, right?
Yes.
What do people say when it's all done? Do they say they should have done this years ago?
I had a patient who was so surprised about the result, and then they said, what was my hesitation? I can't believe I waited this long. If I didn't wait, I had another patient who was a chef, and he told me that, Doc, when I experiment in the kitchen with the food, I don't wear these dentures,
Okay.
and because with these dentures, I don't taste the food well, and in my restaurant, I don't usually go out and see my customers who want to compliment me, because I'm embarrassed to show with these ugly-looking dentures. And well, we fixed his teeth with implant-supported bridges. A couple of years down the line, when I talked to this patient, I said, "How you're doing?" He said that, "You can't believe it. My business is blossoming," and he has so many patients, so many customers, and he's so happy. He's very busy.
So because now he doesn't have a loose-fitting denture,
Yeah.
he's out being
And yeah,
social.
these
is that
are
what you're
his
saying?
words. These are his words, and all he had to change is his teeth.
Okay.
All this time, his business was blossoming, and he was doing extremely good in everything, in his relationship with his customers, with his wife, and the only thing he changed himself is getting rid of those dentures.
Okay, and I want to make sure I understand this correctly. Okay, so across the country, the way, and I know in San Diego it's this way. You go to one guy, one
Yes.
dentist for the surgery, maybe an oral surgeon, periodontist.
Yes.
Then you go to another person that puts the tooth on top of the dental implants.
Mm-hmm.
Then you go to another place that does the imaging. And each has several appointments. So you do the surgical part
In
and the other part. So it's,
In our office, we do combine all of them together because I believe that,
is it better?
yeah, of course
In your
it is.
opinion?
I believe that it should be done by restorative dentist. The implant placement should be done by a restorative dentist.
What does that
because
mean?
that's the
person
guy.
when you say restorative dentist, what does that mean?
Yeah, that means that the guy who is gonna put a crown on top of the implant.
Okay, got it.
Because he has the end picture in mind. And keep in mind, if it's done by one person, there is no communication problem between different dentists and the imaging.
Well, it's nice to, I guess, to go to one doctor. People don't like going to the dentist. Do you ever hear that?
Where
they say, "No
I hear
offense,
that.
doctor"?
I hear that all the time. They say, oh, the first thing they say, even before sitting on the chair, they say, I hate going to dentist.
What do you say to that, by the way? Do you have a standard comeback?
I just,
just
I used
smile
to, when I smile without saying something, then they relax more. When I start arguing about it, then it doesn't lead to anywhere.
And by the way, if you're just tuning in, we're talking about no more dentures, get a fixed set of teeth with just, as little as 2 dental implants, a full arch of teeth to snap in, snap out. Is it true that they can do it in just one day? That means in a perfect scenario, somebody goes in and they walk out with teeth.
Yes. Most of the time today, it's possible to restore an implant, crown on top of an implant right after placing it. And also allow the bone healing to still progress undisturbed.
Okay. And what's changed? Why is it what used to take like 6 months or so to get dental implants now can happen so fast?
Traditionally, the doctors used to go place a titanium implant inside the bone, close it, wait for 9 months up to a year before going back and restoring a crown on top of it. It would take years and some bodacious doctors to push the envelope, to do extensive researches to find out, to come to a consensus about how long it takes for the bone to heal around the implant. And implant designs are changed and the surface texture is changed, which allows us to restore a crown on top of an implant right after placing it.
Can they eat and chew? I mean, how soon, if everything goes right, how soon can they eat and chew?
Most of the time they can eat and chew shortly after the procedure. When there is an extensive implant treatment done, we usually recommend a soft diet for a week or two.
Okay,
before
and then after that
they can
eat.
go back to their
Like a fixed set of teeth, can they eat like an apple or broccoli with these? I mean, can they eat steak?
They can eat anything that they would be able to eat with their natural teeth when they were young.
Is that right?
Yes.
Now-
All the fresh vegetables, corn, and fruits are back on the menu.
Because fiber is very important. I was talking to a friend of mine in their 70s. In fact, it was my dad. So it's not a friend of mine, it's my dad. He says, the problem with eating, fiber is hard to chew.
A lot of patients of mine are happy they receive implants because they are able to keep a normal diet, eat fiber-containing food, and they lose weight.
They tell you that?
Yes.
Do you get stories of what they eat? Do they ever tell you what they eat?
They don't tell me what they eat, but they tell me that they look more slim and more healthy because of the healthy food they can eat. And since the chewing is improved, the digestion is improved as well.
So options for denture wearers. Okay, so the denture wearer watching this, what's the entry level and and what's the maximum, the best option for them?
Here is the first option, Randy, where there is a denture fixed on 2 implants only.
So that's like a lower jaw.
This is like a lower jaw, and this is about as accurate as tight they get.
Let's take a look at this. Okay, so with this right here.
With that right there, I had a patient who restored
Just 2 implants right there.
with 2 implants, made the denture snap in, snap out type.
Okay.
And she forever got rid of the denture adhesive.
Show
that she used to
underneath
use.
that. So you could, underneath there's snaps. You could show those to the camera for just a moment. So the snaps, can you use their regular dentures?
It is possible to use patients' regular dentures to modify them to be able to house the implants.
So cosmetic dentures. So you can make it look more natural.
We can make it look more natural with whiter teeth, nicer alignment, more natural looking.
Okay.
And for the patients get a lot of benefits out of that. First of all, other than it's stable, they forever get rid of the denture adhesives. And
Do they
works
complain they don't like denture adhesives?
even though the denture adhesive improves the stability, but they don't like using it because they don't like the taste. Some of them are having gag reflexes because of the denture adhesive. They don't like using it. They also don't like the massive plastic in their mouth.
Okay.
Especially on the upper jaw, when that massive plastic covers the palate. Covering the palate doesn't allow them to taste their food well enough. I know some patients also have a gag reflex to that. Stabilizing the denture with implants helps removing that palate. So we can remove that.
So for an upper denture, because I hear they're pretty good though, because of the suction.
Yeah, most of the time they are more stable than the lower. Yes. But the biggest problem with upper denture is the palate.
It's covered. So you can give them a full arch of teeth on the upper with how many implants? At the least.
At least 2 implants.
Is that right?
Could stabilize the. Yeah, we can give them full arch of dentures.
What about the next level up?
The next level up would be the same snap in, snap out on top of 4 implants, which will make the denture even more stable, closer to the unremovable denture. They are very stable. They can chew on every type of food they want. The following level would be restoring the teeth with fixed, restoring the dental arches with fixed teeth.
Okay.
4 to 6 implants are sufficient enough to restore the entire arch with fixed teeth.
Now you do a procedure, you call it all on 4. Yes. That's 4 implants for a full set of teeth.
Yes.
Tell me about that.
All on 4 is a procedure when there are 4 implants placed in different angulations inside in an arch, and the entire arch of the teeth are restored on top of those 4 implants, as stable as natural teeth. Patients can chew on any food they want. It is not removable, and it's removable only by the dentist.
So all on 4, do they ask? It's called all on 4?
Yes, it's called all on 4. It's good for the patients who have dentures for a long time, and a lot of bone structure is resorbed, and they don't have enough bone to restore implants. But normally, there is enough bone to place 4 implants. And a lot of times, these surgeries are done with the help of computer-aided tomography, and surgery doesn't involve too much cutting and is very pleasant to the patient, no complications to the patient. It's done in about 1 hour, and patients walk out with the denture.
What about somebody that's 75, and that's very young today?
Yes.
And they've been in dentures since they were 30, and they've been told, maybe somewhere else, you don't have enough bone for dental implants. Yeah. Because you say that's not the case.
Before utilizing all-on-4 procedure, doctors would do bone grafting, extensive bone grafting, to grow bone in order to be able to place implants in patients' mouth who have excessive bone loss. In some cases, even they would harvest the bone graft from the hip, from other parts of the patient's body. That sounds very painful to the patient. But today, thanks to all-on-4 procedure, no bone grafting is necessary. I had a patient, Randy, she's from North Hollywood.
Okay.
And she used to wear dentures for about 30 years. All that time, continuing wearing the denture made her bone tissue to resorb away.
So when you wear a denture, what's happening? You lose bone.
Every day you
Why?
continue wearing the denture, since the bone tissue underneath dissolves away, because there is nothing to stimulate the bone to hold it on its level, a tooth or an implant. Right. She went to a dentist before and asked about implants, but before, when all-on-4 procedure was not around, the doctors told her that she needed excessive bone grafting to restore some bone structure to be able to restore. So she's not really a candidate for implant restoration.
So she was told she couldn't do it?
She was told she couldn't do it.
Unless there was a lot of bone building?
Yes.
Okay.
But now, thanks to this procedure, she was able to place 4 implants in the lower arch and restore her teeth with a fixed, non-removable set of teeth, full arch.
Dental implants last. How long are they supposed to last before they fall out?
They stay there for a long time. The oldest patient I had is 20 years. This is my first implant I placed during my internship. And according to the research, the implants last more than 25 years. But there is no longer research to prove that they can last lifetime.
Are they supposed to last forever? As long as your regular teeth,
I hope they will last for a lifetime. Okay. But since there is no research long enough to show that, 25 is an accurate figure. And the implants we place, we assume they will last at least 25 years. but I hope they will last lifetime. 20 years from now, I may confidently say that, yes, they do last lifetime.
And they don't hurt. You're saying like these procedures,
No, they
60,
don't hurt.
70, 80-year-olds, it doesn't hurt.
It doesn't hurt at all.
Because the bone...
There is this misconception that implant surgery is painful, but it's not. Patients don't usually complain about the pain when we call them the very next day to find out whether or not they had pain. To make the things even more so, the fact is that the bone tissue doesn't contain the pain sensors like the actual tooth does. When the implant is placed inside the bone, since the bone doesn't contain those pain sensors, it's not painful. The pain or discomfort may come from the injection site or the incision site, which is not really unbearable. Patients take a tablet of Tylenol and it disappears.
Very interesting topic, and we're just about out of time, but one of the things that you helped me understand on the phone, and I think it's an important point, is that traditionally, depending on who you go to,
Yes.
dental implant surgeries, they opened up the gums, maybe felt around for bone to see how much bone you have. They would do some x-rays, but that was it. Nowadays,
it's all different. A lot of things have changed with today's computer imagery, CBCT scans.
so you're doing a CT scan.
CT scans and implant surgical guides. We are able to, what used to be somewhat a blind procedure, now we are able to see how much bone we have, how much density that bone has, and where are the vital structures nearby. With guided implant surgeries, we are able to design the surgery before the procedure actually happens.
So it's like done on a computer?
Yes.
Okay, so there's less cutting on the gums because you have like a little plastic guide goes over the mouth and there's holes and you can just stick it through the holes. Is that true?
When it's got...
Because I've seen the pictures.
Yes, it's true. We don't do incision. We don't separate the gum from the bone.
So there's no stitches or anything like that?
No. We just place that surgical guide and make the holes and place the implants. That's it. It's
so
done
it's
in
not
one.
common, though, according to you.
Very few of the
dentists are
implant
doing
dentists,
these guides.
Yes, very few of implant dentists do the implant surgeries with guided surgical guides.
So it's less cutting on the gums.
It is less downtime for the patient. There is no cutting involved. There are no stitches, and it's done in about 15 minutes. Half an hour. The entire procedure is done in half an hour.
When the patients go there on the consult, it's a denture wear. What do they ask you every time? What do they want to know?
First of all, they say whether or not they ask, am I a candidate for dental implants? Can I restore my teeth with dental implants? That's the first question they ask. Mm-hmm. And then they ask, is it going to be painful? How painful is it going to be?
Yeah.
And then the third question they ask is it going to be expensive? And all those are misconceptions that people have around who haven't consulted with a dentist about dental implants. I would invite them in for a consultation to find out about their choices. Everybody is a candidate for dental implants. There is no age limit.
I mean, unless you are in like cancer therapy or uncontrollable diabetes.
Yes.
But for the most part, people...
Even in those cases, it's not an absolute contraindication. It is possible to restore. In certain cases, the doctors take certain precautions to make sure that the medications they take for certain diseases or problems they have don't interfere with integration of implant with the bone.
Okay, good. Now, you do a lot of things. You do cosmetic dentistry.
Yes.
And we should mention you do these under IV sedation in many cases, so it's very safe. Is this the happiest group of all dental patients? The denture wear that you can give teeth back to, like a fixed set of teeth?
When I was a teenager, I used to think that 65, 70-year-olds don't date. Now I have so many patients who, after restoring their teeth, they come back, they say, oh, my life is back. I'm so happy now and I'm dating. I had a patient, as a matter of fact, she got married less than a year after we restored her teeth with dental implants. She used to wear dentures. The confidence comes back. They feel much younger, increased libido. The life is so hot now, Randy.
Good,
and then I had a patient, patients are losing weight because they are able to eat more fiber-containing food. I had another patient, he was a musician. He had his front teeth missing, and he used to play on duduk. If you are familiar with that instrument, it's a soft-toned reed instrument, like a flute.
Okay.
And He came to me, he wanted something fixed because every time he would
A
play
fixed
on
set of teeth.
fixed set of teeth.
Okay.
Every time he would play on that instrument, that denture would vibrate, and the whole experience was horrible.
Okay.
So on the sitting visit, when we fastened the fixed teeth on his front part of his mouth, he took out his instrument from his jacket, and he told me that
story.
I need to play to test it, to make sure if these feel as good as my natural. It was heavenly if you have ever heard the sound of that instrument.
Wow.
We liked his music so much, I asked him for his CD.
That's a good story. Well, look, we are out of time. Great stuff. Okay, so the main message here obviously is no more dentures. If you're a denture wearer, 2, 4, 6 implants, snap in, snap out, or a full arch of fixed teeth with as little as 4 implants. And you're never too old, you say, so go in there and get a consult.
Yes, I would. Please visit my website. It's www.cyberdentistry.com.
Cyberdentistry.
Yes, you can learn a lot about implants and different other procedures we do. Or you can come and see me in my office. Consultation is complimentary. We can sit down and I will explain all the choices the patients have to restore their mouth with fixed teeth.
So a free consultation.
Free consultation.
That's not, and by the way, that's not common.
No.
I thought it was, but I guess it's not common. A lot of doctors. And your wife's a dentist. We didn't mention that, but she doesn't work in the same office.
No,
Is
she
that
has
right?
her own practice.
Okay.
We collaborate sometimes.
Well, thank you for coming on the show. Great stuff. Really
Thank you
good.
too, Randy. It's
You've
my
been watching
pleasure.
The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go to our website and you can put in Glendale Dental Implants or Dr. Baghdasaryan. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.